Hi everyone. So this is Dr. VG and welcome to this discussion about the introduction to the OPD Masterclass. So OPD Masterclass has 6 lectures particularly dedicated for each system, and this class will be in live plus recorded format. So don't worry, if you miss any lecture you can watch the recordings, and even after some period of time recordings will be available for your purchase, as well as along with that you will also get the OPD book that has been written by me. So just let's go through what are the key features and what systems we're going to discuss day wise. So the first lecture will include the endocrinology as well as renal system. So in endocrinology we'll be moreover emphasizing on the common endocrine topics, for example diabetes. So in diabetes, entire type 1 type 2 diabetes, how to titrate the medications, how to give insulin. Okay, so all these things will be discussed in detail about the complications of diabetes. Okay, how the monitoring has to be done for diabetes, what are the recent medications like tirzepatide, GLP-1 analogs. Okay, so all these things will be discussed in diabetes section. Plus we'll also discuss about the thyroid in detail, both hypothyroid, hyperthyroid, how to adjust the doses, how to modify the doses if patient comes with a hyperthyroid, what exactly medications we should do, how the dose adjustments is needed for hyperthyroidism. Okay, even if patient is having Hashimoto's thyroiditis, how to approach. Even if patient has thyroid nodule, then how should we approach? Okay, all these things OPD approaches we're going to discuss in this in a case-based format. Like we will be talking about, for example, 40-year-old female is there, and now this patient is having this complaint. So how should we approach? So we'll discuss that in a thoroughly in a question based as well as MCQ format. Okay. Then along with the thyroid, we have adrenals, very commonly Cushing's and Addison's also you can see in OPD practice. Coming to the pituitary, okay, pituitary mainly you will not see major, but if you talk about the LH, FSH, okay, in pertaining to the your infertility, okay, yeah. So infertility section will be covered with the pituitary component. Even erectile dysfunction, which is common OPD presentations. Okay, so all these things will be covered here in case of endocrinology in a detail. Every drugs, every doses, what are the drug interactions, what are the contraindications, what are the side effects, everything, what are the doses, and everything, what are the recent advances in that. Okay, even obesity, very important recently. Okay, obesity, metabolic syndrome. So all these things will be discussed in the endocrinology. Talking about the renal system, particularly you will have either AKI or CKD. So we'll focus more on the AKI as well as CKD. But in CKD, moreover, what are the complications of the CKD? How to manage those? For example, anemia. Okay, so when do we give iron? When do we give erythropoietin injections or thrombopoietin analogs? Okay, those stuff. Even complications of the CKD or complications of the hemodialysis, those we're going to discuss over there. Even the renal osteodystrophy, etc. Okay, all those stuff we're going to discuss. Even one more thing in the endocrinology left to say about the osteoporosis. Okay, the bone health, osteoporosis we're going to discuss over here, because that's also one of the commonest manifestation you can get in the OPD practice, right? So that's about the first module, that is endocrinology and renal system. Coming to the neurology, then again neurology is itself a huge topic. It has been divided into 3-4 sections. First, for example, if we talk about the stroke, mostly you will not get OPD presentation, but yes, we will discuss in a brief about the stroke. What are the particular areas or localization of the stroke? Okay, how to manage the stroke, when to refer the stroke, what are the treatment options we have, for example, endovascular therapy or your thrombolysis. Okay, so that will be stroke. Then also what are the complications of the stroke, etc. Even IC bleeds. Okay, that will be a brief overview, because this is not a OPD issue, this is an emergency issue. Then more important for OPD is about the seizures or epilepsy. Okay, how to manage epilepsy patients, when to start antiepileptic with the one unprovoked seizure or one provoked seizure. Okay, so all these things we're going to discuss over there. Then about the headache, it's very important. Types of headache, tension type of headache, cluster type of headache, paroxysmal hemicrania. Okay, then hemicrania continua. Okay, so all this stuff we're going to discuss in the headache, including the migraine, obviously. Okay, so that's kind of bread and butter for the OPD people with the headache. Lots of time you will see this type of patients, and what exactly you have to give, when you have to actually give triptans, etc. How to do migraine prophylaxis, which patient actually require this prophylaxis. So those all things we're going to discuss over there. Coming to the neuropathies, very important, because that's also one of the commonest presentation you can get. So peripheral neuropathies, how to approach the peripheral neuropathies, what are the underlying etiologies behind that. So those things we're going to discuss. Then coming to the spinal cord disorders. So here majority will get the disc prolapse or compressive myelopathies. So we will briefly see the overviews of those and how to approach those cases. Mostly these are handled by the neurologist, but yes, as an OPD physician or OPD practitioner, you should know the basics of that. Okay. Along with that, MS is kind of rare. MS NMO is mostly rare, and even though it mostly goes to the neurological aspect. Now coming to the most important is degenerative disorders like Alzheimer's disease, when to give memantine, when to give donepezil. Okay, all these things. When to give troxaphenidyl in case of Parkinson's. So degenerative diseases with the Parkinson's, Alzheimer's, the important focus over there. Okay, so those stuff we will discuss in the neurology. Coming to the surgical issues in the medicine OPD, so that will be particularly discussed by a surgeon, Dr. Pallavi Kulkarni. So she will be talking about what exactly, for example, hemorrhoids, how to approach the hemorrhoids. Okay, even the diabetic foot, how to approach the ulcers in the OPD practice. If you get any patient with a trauma in OPD, what exactly are the first aids that you have to do. Okay, so that will be the third lecture. Coming to the fourth lecture, CVS, absolutely we're going to discuss in detail about that. So don't worry about that. Myocardial infarction, particularly about the angina component, because OPDs usually have the angina component, atypical angina, typical anginas, how to manage those, how to titrate the doses, all those important stuff we're going to discuss in that. Okay, along with the angina, about the unstable anginas on all will be included in the angina blanket. Then your hypertension, very important. Then heart failure, both with the preserved ejection fraction, reduced ejection fraction. Moreover, it is of kind of follow, but it is important to know. Okay, as the OPD practitioner also. Then pulmonary artery hypertension, even valvular heart diseases. If you, it's rarely nowadays it's seen in the OPD practice, but we will see the basics of that. That what options we do have in these cases. Okay, so that's about the valvular heart disease. Along with that, in case of CVS, even pericarditis, okay, and the even cardiomyopathies we will briefly cover. Moreover, in cardiomyopathy, you have the postpartum or peripartum cardiomyopathy, that's PPCM, that's commonly seen. Along with the Takotsubo can also be coming to your OPD as a general practice. The rest of the things mostly goes to the cardiologist, but we should know when to refer and in which cases we have to refer. So that's about the day 4. Coming to the day 5, we have gastrointestinal system and infections. So in GI, we will discuss extensively because it's very important, and we'll start the esophageal disorders. We'll then discuss about the gastric disorders, like for example, gastric ulcer disease or peptic ulcer disease with the duodenal ulcers, gastric ulcers, both components. Okay. Then we'll discuss about how to approach vomiting, nausea, diarrhea, unintentional weight loss. Okay. Or if somebody wants to gain weight, then what nutrition they have to take. Okay. So all this nutritional aspect, as well as in detail about the esophagus, stomach, okay, even intestines, okay, plus inflammatory bowel diseases, and most importantly, inflammatory bowel syndrome, IBS. It's very common nowadays, and that we should definitely know. And along with that, we'll also have a focus on the gut health. Okay, that what exactly are the factors that helps in the gut health, and what parameters you should tell the patient, or what diseases are dependent on the gut health. So entire things will be discussed in the gastrointestinal disorder. Now, along with that, on that day, we'll also discuss some common infections which you regularly see in the practice. For example, let's talk about the bacterial, viral, and fungal. Okay, so in bacterial, you mostly get the community acquired pneumonia. We'll see the curve score, that when do we refer the patient to the ICU, when do we admit, when do we manage on the OPD basis, what are the treatment regimes that are used for the community acquired pneumonia. Okay, so those are the important stuff that you should know in the OPD basis, OPD practice. Also, how to treat the infective curve, infective diarrhea, etc., etc. So those all bacterial things we will going to discuss over there. Even urinary tract infection, infective endocarditis, which is kind of rare, but yeah, we'll discuss those stuff as well. Coming to the viral, in viral mostly we will know the approaches to the hepatitis B, hepatitis C, okay, HIV, hepatitis A and E, because that's also very common. Okay, so these are more focus on the viruses. Also, we'll have a brief overview about the chicken pox. Okay, measles is kind of rare, okay, because of the vaccination. But yeah, we discuss this important stuff. And In moreover immunocompromised patient, we will see the other viral infections like CMV, even sarcoma and all. So those are like out of scope of this OPD practice. Coming to the fungal, we will see like common fungal infection that come to the practice. For example, itching all over the body, scabies and all. Okay, so all these things will be discussed in the fungus, including tinea cruris, tinea capitis, etc., even dandruff, hair fall, and all these things related to the fungal infections. We're going to discuss those also. Okay, coming to the day 6. Now, till now, we have extensively discussed in everything. So, in pulmonology, moreover, we will discuss about the cough, how to approach the cough, how to approach the dyspnea, okay, how to approach the pulmonary artery hypertension, how to approach the COPD, okay, how to approach COPD, how to approach asthma. So these are the major points focus in the pulmonology. Coming in dermatology, again the skin infections that we just discussed above, we'll be discussing same things, okay, either there or here. Then toxicology, we'll discuss the common patients for coming to the OPD with toxicology. For example, if somebody has drunk Dettol or somebody has drunk Harpic, then what should we approach? When should we refer? Where should we refer? Okay, and what would be the due course of the treatment in such cases? So as a physician, as a practitioner, you should have that idea. Okay, after that, now 6 days we've extensively covered entire systems. Then on day 7 we will have a grand quiz, and the best part about the quiz is, you will get the first prize as a litmus stethoscope, plus there will be top 3 winners with ebooks. All the books you can get, Harrison ebook, Amed ebook, whatever you want. Okay, that's two worth up to 10,000 rupees. So it's definitely, I think, must do opportunity for you all if you are interested to upskill your OPD practice, because nowadays you don't see that majority and variety of the patients. And if you get all these things at one point, just to quickly revise, or if you just go once through these guidelines and approaches, so we will discuss based on the Harrison up to date, okay, and all the standard textbooks like Davidson, etc. So make sure you follow this and you approach these approaches you keep with you, and definitely that will help you in excelling your practice, and you'll definitely stand out from the crowd whatever practice you are doing. Okay, so now I'll just show you the notes about the OPD practice. So this is how the OPD practice notes are. So first you will have the clinical history over here, investigations, approach, how to do, and management plan. That's a basic. Then we'll discuss each thing about the cough. So pathophysiology of the cough reflex, acute versus chronic cough. Okay, causes for acute chronic cough, even the common causes of the cough. So this is about our OPD book. Okay, so as you can see, it's imaging, all the images and all have been added. So it is so easy to read. So it helps really in a good way. And I would say more than 500 students have got this just a book till now. So if you are interested in the OPD masterclass, it's gonna be bonus for you, because you will get both the ebook as well as the masterclass also. So that's up to you, that if you're someone who wants to just revise quickly and just go through all the important points, you can get the video lectures as well. And if you are someone who wants to read thoroughly and depend on themselves when it comes to revising the stuff, then you should just get the book. Okay, so that's all. If you have any queries, you can message me, or you can comment below, or you can message my assistant 7588 354545. Okay, he's our manager. You can message him for purchasing this course. I'll also adding the links for the course in the information box over here, and also in the comments. And if at all you have any doubts, you can anyway DM at either Health with VG, okay, or Adrenaline. You know that stuff, right? Either Health with VG or even Adrenaline method. So you can any day message me or DM me over there, or you can message my manager also. So he will help you with any ways. Obviously, there will be some extra step, two-step verification will be added. You might have to share the screenshot after the payment to this number. Okay, but we have added that just because to save the piracy. Okay, because you also know that what amount of the hard work it requires to just put on things together. Okay, so that's, I just want to put it best for you. And yes, very important one point, if you have already purchased the book and now you want to just take the lectures, 50% off will be there flat, no questions will be asked, because you already trusted in the purchasing of the book, and I don't want to hammer you again with the additional extra costs. Okay, so it's up to you. If you are obviously very much pleased, you can pay extra, that's all right, but it's not mandatory. Okay, so just message 7588 354545 again. For that purpose, he will again give you the coupon code, and with that you will get flat 50% off if you have purchased the book. Okay, so that's all. If you have any doubt, just let me know in the comments. Thank you.